Picture yourself sitting in your favorite chair, the one with good light by the window, holding a book you've been looking forward to reading for weeks. You open to the first page, and something feels off. The words aren't quite as sharp as they used to be. You blink a few times, adjust the book closer then farther away, searching for that sweet spot where everything comes into focus. Maybe you tell yourself it's just tired eyes, or that you need to update your reading glasses. And maybe that's all it is. But what if it's not? What if your eyes are trying to tell you something more important? Something that, if you catch it early enough, could save your vision for the decades ahead. After the age of 60, your eyes go through changes that are completely normal, but some of those changes are early warning signals for conditions that can steal your sight if they're ignored. The difference between catching these signs early and missing them entirely can mean the difference between clear vision at 75 and struggling to recognize faces, read labels, or drive safely. And here's the part that matters most. The 3 signs we're about to walk through don't announce themselves with pain or sudden drama. They show up quietly, subtly, in ways that are easy to dismiss or explain away until the damage is already done. Welcome to Dr. Welling Insights, where complex medical information gets broken down into clear, practical knowledge you can actually use. I'm here to walk you through 3 specific early warning signs of vision loss that tend to appear after 60, why they happen, what they're telling you about what's going on inside your eyes, and most importantly, what you can do about them while there's still time to make a difference. If straightforward, evidence-based health content is what you're looking for, go ahead and hit that subscribe button right now. It helps this channel reach more people who need this information, and we're building a community here focused on understanding our health in ways that empower us to take meaningful action. Let's start with the first early sign, and this one is something that happens gradually, so gradually that most people don't even realize it's occurring until it's been going on for months or even years. You're driving at night, something you've done thousands of times without a second thought. But lately, oncoming headlights seem almost blinding. They create halos and starbursts that make it hard to see the road clearly. Streetlights look like they're wrapped in fuzzy rings of light. You find yourself squinting more, gripping the wheel a little tighter, maybe avoiding night driving altogether because it just feels harder than it used to. During the day, colors seem a bit duller, like someone turned down the saturation on the world around you. Blues and purples are harder to tell apart. Reading in dim light, something that never used to be a problem, now requires you to turn on every lamp in the room. These aren't dramatic changes. They're subtle shifts that creep in so slowly you might not even mention them to anyone. But they're all connected to one underlying process happening inside the lens of your eye, and that process is called cataract formation. A cataract is a clouding of the natural lens inside your eye, the clear structure that sits right behind your pupil and focuses light onto your retina. When you're younger, that lens is transparent, flexible, and does its job without you ever thinking about it. But as you age, the proteins that make up the lens start to break down and clump together. Those clumps scatter light instead of letting it pass through cleanly, and that scattering is what creates glare, halos, and that washed out, muted quality to your vision. By the time you reach 60, some degree of cataract development is almost universal. It's not a question of if, but when and how fast it progresses. For some people, cataracts develop so slowly that they don't interfere with daily life for years. For others, the progression is faster, and the impact on vision becomes noticeable within a much shorter window. The key is recognizing the early signs before they limit what you can do safely and comfortably. One of the earliest and most common complaints is that nighttime driving becomes uncomfortable or even frightening. Oncoming headlights, which used to be just a normal part of the road, suddenly feel like they're shining directly into your eyes with an intensity that makes it hard to see anything else. That's because the clouded lens is scattering the light from those headlights in all directions instead of focusing it neatly onto your retina. The result is glare, and it's one of the first things people notice. Another early sign is needing significantly more light to read or do close-up tasks. You might find yourself moving closer to windows during the day or adding extra lamps around the house. Tasks like threading a needle, reading small print on medication bottles, or working on hobbies that require fine detail become harder, not because your arms are too short or your hands are shaky, but because the light isn't getting through your lens the way it used to. Colors also start to shift. Cataracts tend to give everything a yellowish or brownish tint, and colors that are close together on the spectrum, like blues and greens or purples and blacks, become harder to distinguish. You might notice this when you're getting dressed and realize you've been wearing mismatched socks, or when you're picking out clothes and what you thought was navy blue turns out to be black once you step outside. Here's what a lot of people don't realize. Cataracts are not something you have to live with until you can't see anymore. Cataract surgery is one of the most common and most successful procedures in all of medicine. It involves removing the clouded natural lens and replacing it with a clear artificial one, and the results are often life-changing. People describe it as getting their world back, seeing colors vividly again, being able to read without straining, and driving confidently at night. But here's the part that matters for this conversation. The earlier you recognize the signs and start monitoring them with an eye doctor, the better you can time the surgery for when it will give you the most benefit. You don't want to wait until you've already given up activities you love, or until your vision has deteriorated to the point where it's affecting your safety. Regular eye exams, especially after 60, let your doctor track how fast your cataracts are progressing and help you make informed decisions about when to intervene. If you're noticing increased glare, difficulty with night driving, fading colors, or needing more light for everyday tasks, don't brush it off as just getting older. Get your eyes checked. Cataracts are treatable, but only if you know they're there. Now let's move to the second early warning sign, and this one operates in a completely different way. It doesn't make things blurry or dim. Instead, it creates a specific kind of distortion that shows up right in the center of your vision, exactly where you need clarity the most. You're reading the newspaper, and you notice that the lines of text aren't quite straight anymore. They seem to wave or bend slightly, like you're looking at them through water. You're looking at a door frame or the edge of a window, and instead of appearing perfectly vertical, it looks slightly curved or warped. Faces start to look a little off. You can see the person clearly, but the details in the center, the eyes, the nose, the mouth, seem distorted or less defined than they should be. You might notice a small blurry spot right in the middle of your vision, a spot that doesn't go away when you blink or rub your eyes. These are not normal signs of aging. These are early symptoms of a condition called age-related macular degeneration, or AMD, and it's one of the leading causes of irreversible vision loss in people over 60. The macula is a small, highly specialized area in the center of your retina, responsible for sharp, detailed central vision. It's what you use to read, recognize faces, watch television, drive, and do any task that requires you to see fine detail. Age-related macular degeneration is a progressive disease that damages the macula, and it comes in two forms, dry and wet. Dry AMD is more common and progresses more slowly. It happens when the light-sensitive cells in the macula gradually break down over time, leading to a slow thinning of the macular tissue. Wet AMD is less common, but far more serious. It occurs when abnormal blood vessels start growing underneath the retina, leaking fluid and blood, which damages the macula quickly and can cause rapid vision loss. The early signs of both types are similar, and the most telling one is distortion. Straight lines that should look straight appear wavy, bent, or broken. This happens because the surface of the macula is no longer smooth. Fluid or cellular changes are causing it to bulge or thin unevenly, and that distorts the image your brain receives. Another early sign is a small, dark, or blurry spot in your central vision. It might start out barely noticeable, something you only catch when you're reading or looking at something with fine detail. But over time, that spot can grow and interfere more significantly with your ability to see. Here's why catching AMD early is absolutely critical. While there's currently no cure for dry AMD, there are treatments and lifestyle changes that can slow its progression significantly. High-dose antioxidant vitamins and minerals, specifically formulated based on large research studies like the AREDS and AREDS2 trials, have been shown to reduce the risk of progression to advanced stages in people with intermediate AMD. Eating a diet rich in leafy greens, fish high in omega-3 fatty acids, and colorful vegetables supports macular health. Not smoking is one of the most important protective factors, as smoking dramatically accelerates AMD progression. For wet AMD, early detection is even more urgent because there are treatments that can stop or even reverse vision loss if they're started quickly. Injections of medications called anti-VEGF drugs can stop the abnormal blood vessel growth, reduce fluid leakage, and preserve or even improve vision. But these treatments work best when the condition is caught early, before significant scarring or damage has occurred. If you wait until your central vision is already severely affected, the window for effective treatment narrows considerably. The single best tool for catching AMD early is something called an Amsler grid. It's a simple grid of horizontal and vertical lines with a dot in the center, and you can use it at home to monitor your central vision. You look at the dot with one eye at a time, and if any of the lines appear wavy, distorted, missing, or if you notice a blurry spot, that's a signal to see an eye doctor immediately. Many eye care professionals recommend that people over 60, especially those with risk factors like a family history of AMD, smoking history, or light-colored eyes, check an Amsler grid regularly, even just once a week. It takes less than a minute and can catch changes before they become obvious in daily life. If you've noticed any distortion in your vision, even subtle bending of lines or slight blurriness in the center of your field of view, don't wait to see if it gets worse. Get to an eye doctor. AMD progresses. And the earlier you intervene, the better your chances of preserving the vision you have. This is not a condition where waiting and seeing is a safe strategy. Time matters, and your central vision is too valuable to gamble with. Now we come to the third early warning sign, and this one is particularly insidious because it doesn't affect the sharpness or clarity of your vision at all, at least not at first. Instead, it quietly steals your peripheral vision, the edges of what you can see, and it does it so gradually that most people don't notice until a significant amount of vision is already gone. You're walking through your house and you bump into a door frame you've walked past 1,000 times. You're driving and a car seems to appear out of nowhere in the lane next to you, even though it was there the whole time. You're reaching for something on a shelf and you misjudge where it is, knocking it over instead of grabbing it cleanly. You might feel like you're becoming clumsier, less coordinated, or just not as aware of your surroundings as you used to be. You might not connect these experiences to your vision at all, but they can be early signs of glaucoma, a group of eye diseases that damage the optic nerve and lead to progressive, irreversible vision loss. The optic nerve is the cable that carries visual information from your retina to your brain. Damage to this nerve results in blind spots in your visual field, and glaucoma typically starts by affecting peripheral vision first, creating a gradual tunneling effect that can go unnoticed for years. The most common form of glaucoma is called primary open-angle glaucoma, and it's strongly associated with elevated pressure inside the eye. Your eye constantly produces a clear fluid called aqueous humor that circulates through the front part of your eye and drains out through a meshwork of tiny channels. When that drainage system becomes less efficient, fluid builds up, pressure rises, and that pressure damages the optic nerve over time. The problem is, elevated eye pressure doesn't cause pain or any noticeable symptoms in the early stages. You can't feel it. Your vision in the center stays clear and sharp. The only thing changing is your peripheral vision. And because your brain is incredibly good at filling in gaps and compensating for missing information, you might not realize anything is wrong until you've already lost a substantial portion of your visual field. That's why glaucoma is often called the silent thief of sight. By the time you notice something's wrong, the damage is already done. And unlike cataracts, which can be reversed with surgery, or wet AMD, which can sometimes be improved with treatment, vision loss from glaucoma is permanent. The nerve fibers that are destroyed don't grow back. But here's the crucial point. Glaucoma is detectable long before you notice any vision loss, and it's highly treatable. A comprehensive eye exam includes measuring the pressure inside your eye, examining the optic nerve, and testing your visual field to check for early signs of peripheral vision loss. If glaucoma is caught early, before significant damage has occurred, it can usually be controlled with prescription eye drops that lower eye pressure, and in some cases, laser treatment or surgery. The goal of treatment is to prevent further damage. And when that's done successfully, people with glaucoma can maintain functional vision for the rest of their lives. The key is regular screening, especially if you have risk factors. Those include being over 60, having a family history of glaucoma, being of African, Hispanic, or Asian descent, having high eye pressure, being very nearsighted or farsighted, having a history of eye injuries, or long-term use of corticosteroid medications. Even if you don't have any risk factors, annual comprehensive eye exams after age 60 should be part of your routine healthcare, because glaucoma can develop in anyone. If you've been noticing that you're bumping into things more often, misjudging distances, missing objects in your peripheral vision, or if people or cars seem to appear suddenly from the side, don't assume it's just age or clumsiness. Get your eyes checked. A simple, painless eye exam can detect glaucoma early and give you the chance to protect your vision before it's too late. So those are the 3 early warning signs: increased glare, halos around lights, fading colors, and difficulty with night vision pointing toward cataracts. Distorted or wavy central vision, straight lines that look bent, and blurry spots in the center of your field of view, signaling possible age-related macular degeneration. And loss of peripheral vision, bumping into objects, and reduced awareness of things at the edges of your sight suggesting glaucoma. Each of these conditions operates differently, affects different parts of your eye, and requires different approaches to treatment, but they all share one critical feature. They're far more manageable when caught early. Vision loss after 60 is not inevitable, and it's not something you just have to accept. Yes, your eyes age, and yes, certain changes are normal, but the conditions that lead to serious, irreversible vision loss are detectable, and in most cases, they're treatable, or at least controllable, if you take action early enough. The problem is that too many people wait. They assume blurry vision is just part of getting older, that they'll deal with it when it gets bad enough, or that there's nothing that can be done anyway. And by the time they finally see an eye doctor, opportunities for intervention have already passed. Here's what you need to understand. Your eyes don't heal themselves the way a cut on your skin does. Once the lens clouds over with cataracts, it doesn't clear back up on its own. Once the macula is damaged by AMD, those cells don't regenerate. Once the optic nerve is destroyed by glaucoma, those nerve fibers are gone for good. The only way to protect your vision is to catch problems before they cause permanent damage. And the only way to do that is through regular, comprehensive eye exams with a qualified eye care professional. Not just a vision screening at the drugstore or a quick check when you update your glasses prescription, but a thorough exam that includes dilating your pupils, measuring your eye pressure, examining your optic nerve and retina, and testing your visual field. After age 60, this should happen at least once a year, and more often if you have risk factors or if your doctor recommends closer monitoring. These exams catch things you can't see or feel on your own, and they give you the information you need to make decisions about your eye health while you still have options. Beyond regular exams, there are everyday habits that support long-term eye health and reduce your risk of vision loss. Protecting your eyes from ultraviolet light is one of the simplest and most effective things you can do. UV exposure over a lifetime increases your risk of cataracts and macular degeneration. So wearing sunglasses that block 100% of UVA and UVB rays whenever you're outside, even on cloudy days, is a smart protective habit. A wide-brimmed hat adds another layer of protection. Your diet plays a significant role in eye health. Leafy greens like spinach, kale, and collard greens are rich in lutein and zeaxanthin, antioxidants that concentrate in the macula and protect it from oxidative damage. Fatty fish like salmon, mackerel, and sardines provide omega-3 fatty acids that support retinal health and reduce inflammation. Colorful vegetables and fruits, especially those high in vitamins C and E, offer additional antioxidant protection. If your diet doesn't consistently include these foods, a high-quality eye vitamin formulated based on the AREDS2 study can help fill the gaps, but always talk to your doctor before starting any supplement. Not smoking is one of the most powerful protective factors for your eyes. Smoking doubles your risk of developing macular degeneration and significantly increases your risk of cataracts and optic nerve damage. If you currently smoke, quitting is the single best thing you can do for your long-term vision. Managing chronic conditions like high blood pressure and diabetes is also critical, because both of these directly affect the blood vessels in your eyes and can accelerate vision loss if left uncontrolled. Staying physically active supports healthy circulation, reduces inflammation, and helps maintain a healthy weight, all of which contribute to better eye health. Even something as simple as a daily 30-minute walk has measurable benefits. And don't underestimate the importance of good lighting in your home. Adequate lighting reduces eye strain, makes it easier to see details, and helps you navigate your environment safely, reducing your risk of falls and injuries. If you're finding that you need more light to read or do tasks comfortably, that's not a sign of weakness. It's your eyes telling you what they need, and there's no reason not to give it to them. Use brighter bulbs, add task lighting where you need it, and position light sources to reduce glare and shadows. Your eyes work hard for you every single day, processing an enormous amount of visual information and allowing you to interact with the world in ways you probably take for granted most of the time. Taking care of them isn't complicated, and it doesn't require expensive interventions or dramatic lifestyle overhauls. It requires awareness, regular checkups, and small, consistent habits that add up over time. Here on Dr. Welling Insights, the goal is always the same. Take complex medical information, break it down into language that makes sense, and give you practical tools you can actually use in your daily life. Everything you've heard today is general education and not a substitute for personalized medical advice. Your eyes are unique, your health history is your own, and any concerns about your vision should be discussed with a qualified eye care professional who can examine you and guide you based on what they find. If this video gave you new information or helped you understand your eye health in a clearer way, go ahead and hit that subscribe button and leave a like. It helps the channel grow and brings this kind of content to more people who need it. Drop a comment and let me know if you've experienced any of these early warning signs, or if you have questions about eye health you'd like to see covered in future videos. I read every comment, and your input helps shape what we talk about next. Thanks for watching, and I'll see you in the next one.